Hello there. My name is Scott Stiles, and I help medical device companies develop and implement practical, risk-based compliance strategies and right-sized quality management systems. In my last video, I covered harmonized standards under EU MDR and IVDR, which got me thinking about common specifications. If you do want to check out my harmonized standards video, then a link card should pop up for it about now. I'll also put a link in the description as well. But common specifications under EU MDR and IVDR, which is the subject of this video, are actually a bit more interesting, I think. While they are not totally a new EU medical device regulatory concept, they are expected to play a larger role under MDR and IVDR. The definition of a common specification means a set of technical and/or clinical requirements other than a standard that provides a means of complying with the legal obligations applicable to a device, process, or system. Essentially, the European Commission has reserved the right within the EU MDR and IVDR to develop these common specifications for certain groups of devices where harmonized standards do not exist or where they are insufficient to provide a means of complying with general safety and performance requirements, or GSPRs. In addition to technical requirements, common specifications may also cover requirements such as application of risk management, clinical investigations, clinical evaluation, and/or post-market clinical follow-up. As of March 2023, the European Commission has published 3 implementing regulations which lay down common specifications for certain Class D in vitro diagnostic medical devices, groups of products without an intended medical purpose, and the reprocessing of single-use devices. If your organization markets medical devices within these categories, you should find out if there are common specifications which apply to your device. If so, you must demonstrate conformance with applicable common specifications to comply with GSPRs. Showing conformity with GSPRs is a prerequisite to a medical device being CE marked. Now, I just said you must comply with common specifications if they apply, which isn't totally accurate. Based on 2017 745 Chapter 1, Article 9, as quoted on the screen now, manufacturers do not need to comply with applicable common specifications, but should document justification why the solution that they have chosen to employ is acceptable. They should also be prepared for additional questions during the conformity assessment process by notified bodies or competent authorities. So you can take approaches other than common specifications, but it will be a much more difficult road to convince a notified body that the approach is equivalent. So now let's get into a little more detail regarding the types of devices that the common specifications adopted to date are applicable to. The first group we'll cover is certain Class D in vitro diagnostic medical devices covered by Regulation 2022/1107. This regulation lays out common specifications for in vitro diagnostic medical devices intended for detection and/or quantification of markers for several blood group systems, infections, and diseases as shown here on the screen now. The second group of products are those without an intended medical purpose covered by Regulation 2022/2346. This regulation lays out common specifications for groups of products without an intended medical purpose, listed in Annex 16 of the MDR, and specifically includes devices such as contact lenses, invasive cosmetic surgery products and equipment, various light therapy treatments, and electrical brain stimulation equipment. And if you're wondering, tattoo products and piercing products are excluded. I think it is also important to note that for devices without an intended medical purpose, in the preamble to the MDR, Section 12, the European Commission clarifies that such common specifications should be developed specifically for a group of products without an intended medical purpose, and should not be used for conformity assessment of the analogous devices with a medical purpose. Devices with both a medical and a non-medical intended purpose should fulfill both the requirements applicable to devices with and to devices without an intended medical purpose. With this, the European Commission makes it clear that devices with a medical purpose should be using harmonized standards and/or a non-harmonized standard approach to show conformance to GSPRs, rather than a common specification that is intended for devices without a medical intended purpose. The final group of devices covered under a common specification involves reprocessing of single-use devices covered by Regulation 2020/1207. The regulation gives requirements for reprocessing of single-use devices where permitted by national laws. Okay, now you should know what common specifications are and have an idea if they may apply to your device. Now I show you where to find the officially adopted common specifications. Like other regulations, common specifications may be updated, repealed, or new ones released over time. This is why it's very important to periodically go to the source, which is the EUR-Lex website. This is an official website of the European Union and provides access to European law. I'll put a link in the description to the EUR-Lex site for you. If you've never been to the EUR-Lex site, once you get there, you may be wondering how to effectively search for common specifications. There are a lot of documents within the EUR-Lex database, and I found using the quick search option can give results that are difficult to navigate. So I recommend using the advanced search option. The link is just below the search button. I have had success setting the following advanced search parameters shown in this screenshot. You'll want to check the box just below advanced search to limit to legislation in force. Then, in the collection dropdown, select legal acts. Finally, in the text search, type in common specifications in quotes. Select the and search modifier, then enter devices. For both text strings, check the in title box. For me, this limited the results to only common specifications related to medical devices and regulations that is currently in force. You can go ahead and play around with the options to expand the search to documents that may be under review or not in force, if you like. To wrap it up, common specifications are technical and are clinical requirements other than a standard that provides a means of complying with the legal obligations applicable to a device, process, or system. They provide a pathway of complying with specific general safety and performance requirements for certain groups of devices where harmonized standards do not exist or where they are insufficient to meet EU law. Common specifications, in addition to technical requirements, may also cover requirements related to application or risk management, clinical investigations and clinical evaluation, and/or post-market clinical follow-up. Although complying with common specifications, if applicable, is not mandatory, they are usually the first choice for demonstrating conformity to GSPRs as part of the CE marking conformity assessment process. Alternative methods are possible, but come with the additional task of justifying the approach sufficiently demonstrates conformance to GSPRs. Thanks for watching. I hope you find this information helpful as part of your EU MDR compliance strategy. If you need further advice, please contact me through the email linked in the video description. If you liked this video, please like and subscribe to be notified when I put out new content. I wish you all the best during your next audit or inspection. Goodbye.